I don't know what that means, but okay.
Okay. Welcome to the Full Wellness Academy with Christine Conti. And we are so blessed and fortunate to have her here. This is our 2023 World Idea Program Director winner. Yay, we're so proud. And Christine is an international presenter, consultant to many companies, CEO of Conti Fitness, her own company, and COO of the newly formed company, Reinventing the Woman International. And four-time Iron Woman, not Iron Man. Let's change that language, please. So it's all you, Christine. We need to go to Iron Man and say no. No, sorry. We need Iron Woman also. Thank you. Just saying. All right, Christine, go girl.
All right. So I'm super blessed to be here. Number one, thank you so much, Debbie. And I think that any chance that you get to really come together as a group, whether, I'm partial for the women and the empowerment, just being a part of people that can hold you accountable, but not just that, people that can lift you up. And I'm here today to talk a little bit about, chronic pain and how do we overcome. And, what I do and my niche is chronic disease wellness. That's really what I focus on. And I'm actually on location today. One of the companies that I consult for is called Burn Along. They do a lot of just online classes and lectures for people around the world. And what I get to do, and I encourage you, and the reason why I start with this is that I get to get on the ground floor, kind of in the trenches with people, average people, and ask them, what do you need? What do you want? What's going on with your body? And I think it's really important for us to remember that when we're talking about overcoming pain and chronic diseases, is that we need to understand, what does that mean? What is that like? And, I could throw up a big PowerPoint and show you this, but I could tell you that, did you know that 1 in 8 people in the United States has diabetes, one or more forms of it? Did you know that only one of 4 people don't know they have it? I mean, that's a chronic disease. I want you to think of 1 in 4 people in the 1 in 4 adults has one or more forms of arthritis. Adults, that's 18 and over, not 65 and older. This is really important. And of those people, did you know 1 in 2 people in the United States deals with chronic pain? 1 in 2, that's 50%. Look around, all right, on this meeting right now. 50% of us have some sort of chronic pain. And when we talk about overcoming pain from chronic disease, I need to start here. Do we realize that chronic pain is not just physical, that it's mental as well? And when we look at our clients and we look at the people that we deal with every day, sometimes it's really obvious. You see someone that's hunched over, they have kyphosis, or you see someone that's limping, or they have symptoms of Parkinson's and they're shaking, right? That's really easy to identify. But what about the people that are dealing with depression, that are dealing with some sort of eating disorders or mental disorders or neurodiversity, right? Which is, they could have autism or Asperger's. We don't know this because we don't see it. And that's something that, before we even start talking about this, is that we need to have the open-mindedness and the empathy that everybody pretty much is going through some sort of chronic pain. And if it's not every second, I'm going to ask you right now to reflect about a time in your life where you did feel like you were in pain, right? Have you been through depression? Have you been through loss? Have you been through a diagnosis of maybe a disease or a sickness? Because if it hasn't been you, it's definitely been a loved one. Definitely, 100%. So before we start thinking about, overcoming pain from chronic disease, I want you to just have that in your head of how that felt. And I don't mean to make you feel bad today. That's not the purpose. It's just to bring you back to that for a moment, because there's a couple things that I need you to be aware of. When you encounter someone that you may or may not know has a chronic illness, a lot's going on in their head. And when I give lectures and workshops about, hey, let's deal with clients with chronic diseases, or I have people walk in and I said, if you're here for me to give you a list of things like first do this and then do this, or do this exercise and then this, you're in the wrong place, because it starts here is where it starts. And it starts with all of us being cognizant that, hey, you know what? I am proud of you. I'm proud of you for showing up here or showing up for yourself today. And maybe even having an open mind to talk to me if I'm a fitness professional, or if I mean, Debbie, you work a lot with corporate wellness, right? Where am I today? I am on site with corporate wellness, talking and getting an idea of what's going on with people. How's your back? How's, you've got diagnosed with diabetes. How are you feeling? What's going on? So having the ability to ask people questions and be honestly interested in how they feel and what they think. Oh my gosh, people love to talk about themselves, but more importantly, we want to feel like we are somebody, that we're needed, that we're respected, that, oh my gosh, I drive a bus, I pick up garbage, whatever it is, you're needed. And that in and of itself is really important when we talk about overcoming pain of chronic disease. It's getting in here, getting in. You are an important person. You have a some sort of role in this world, right? Um, and it's interesting because you think about, and I always go back to this. I always go back to this. Is the blue zones, right? The places in the world with all the centenarians, right? There's 5 of them. And again, not getting too far into this, but one of the ways that people overcome pain, and I'm throwing away either the exercise and the nutrition at this point. Um, it's having a sense that you have a purpose. That's it. Having a sense that you have a purpose. Many people, in order to start overcoming chronic pain, they have to remember that there's a purpose for their life. And sometimes it takes maybe a stranger, maybe someone that's working with them, to say to them, wow, you are awesome. You are really great. You're so inspiring that you keep going. That could be someone's purpose. And these are the things that I just want you to have in the back of your mind. Okay. Before you even open your mouth and say, let me help you with your fitness. Let me help you with your nutrition. It's first, I want to pump you up and say, you got this. All right. Because I'm going to bring you for a moment to the story of the black dot. Has anyone ever heard this story before? Black dot? So good. All right. So super short. Ready? Super short. Love stories. So there's this professor of English. He brings the students in. He gives them each a piece of paper, and he puts up on the overhead. He said, okay, I want you to write about what you see. Okay. Up on the overhead, the only thing on the overhead was a piece of paper, big piece of paper with a tiny black dot in the middle of it. And he said, okay, I want all of you to write what you see. And the class was like, what? Huh? What is this? So he gives them like 20 minutes. They write down, picks up their papers, goes through them. And he said, you know what? It's crazy. I've done this exercise like 50 times. And not once has someone written about all the space that's on this paper. Not once. Because you know what they write about? They write only about that black dot. They focus on that black dot and they can't even see the rest of the space. This is what people deal with when they have they're in chronic pain. They don't see anything else. They can't even open their mind to anything else going on in the world because they're just focusing on the black dot, their pain, their negative. So we have to be the people to point out all of the other things going on in their life. And it is so psychological. And I'm not saying that any of us are all psychologists out there, but pain is really important because it's a lot in the mind. So why I tell you that is because what can we do? What can we do when someone else gets up every morning and all they focus on is that pain in their back or my foot really hurts? And I know that all of us have had moments in our life where you've had a migraine or you've had a terrible toothache. Okay, you've had a broken bone or a leg, or you hurt your back to the point where it's like something's pressing on a nerve. You can't focus on anything else in the world but that pain. And guess what? Could you imagine that being every single day? Every day. It doesn't go away. Every single day. What does that do to your mind? There is that connection between physical pain and emotional pain. People that are in pain tend to be depressed. They tend to have a lot of anxiety. And it's not always spoken about. It's not always talked about. And that's the one thing I want to drive home today is that we have to be the people that say it's okay to talk about it. Tell me about how you're feeling. Okay, that's great. But now we need to take some action plans to maybe feel a little bit better. And one of them that I love to say is people have called me in the past and I work with people that have chronic illnesses and arthritis. And I'll give you an example. Spinal stenosis really bothers your lower back. And they'll say, Christine, my back is really sore today. I don't think I'm going to do any. I think we should cancel. Okay. As a business person, I'm like, oh man, I'm going to miss out on that money. As a human, as really, I don't want anyone to cancel because I will say to someone, okay, here's the deal. I'm going to give you some tough love, which is actually real love, and say, listen, you have two choices. You can cancel today and you can quote unquote rest and not do anything. And most likely your back is not going to feel that much better. All right. Or what we could do is we can actually meet today. And I'm going to meet you where you're at. I'm not going to push you to the point of extreme pain. I said, but we're going to do at least some gentle movement and stretching so I can deep breaths. Let's get some oxygen through your blood. Let's oxygenate your blood. Let's get your circulation going. Let's do some movements. So maybe, just maybe, your back is still going to be bothering you, right? But you could sit there and have it be bothering you, or you can be being proactive or working towards a little more strength, a little more range of motion. And I just bet that extra blood flow and that circulation is going to make you feel overall better. That's what I bet. And I have to say, I think 99.999% of the time that I've ever done that in the last 20 years, someone has not said, yeah, no, halfway through. They haven't. And what's crazy is that this can be anything. I know that I'm saying this about fitness, but let's take this over to nutrition, right? Hey, let's just try something little. Let the person that has diabetes, that's in, chronic state of anxiety and I don't know what to do and, issues with their feet and circulation. Do we tell them, like, oh, just get over it, or I don't understand, I don't have that, or no, it's I'm here. Tell me about what's going on today. Tell me about how you're feeling. All right, what little step are you willing to do? All right, you're not willing to do that? All right, how about we do this? It's honestly having that just ability to ask and not be afraid. All right, you're in chronic pain. My heart goes out to you. This is not something we're going to harp on. It's not the black dot. We are here to talk about everything else. Don't tell me what you can't do. Show me what you can is really, really important for this. There is no babying with, and I know I'm getting really riled up, Debbie. I'm sorry, but it's there's a point where people start to feel bad for themselves. I'm in chronic pain. I can't do this. I can't do that. I can't. Well, what can you do? And and that's where we start to get into this of I'm done. And I know that for me as a, as a speaker, as a someone who works with you, I am not for everyone because I refuse to hear no. I refuse to have someone say, I can't. Because the second you stop moving, the second you stop learning, the second you stop trying, it's all over. And that's something, people with chronic pain start to feel bad for themselves and say, oh, woe is me. I'm not doing this and I'm not doing that. Well, what is it that you are going to do? Are you willing to live? Are you willing to fight for your life and for your independence? Then come talk to me because I'm willing to do whatever it takes to help you live the quality of life that you deserve. So, and, we talk about that lifespan versus health span. That is something so important to explain to someone with chronic pain. What is it that we can do? Is it movement? Is it, maybe eating a little more fruits and vegetables? What the heck is it? Is it stretching? Is it breathing? Is it just coming to me? And for the first 15 minutes, we just talk about nothing, about your cat Fluffy. I don't care because it starts here. March in place. Okay. Tell me about something funny. Um, these are the things that I think that we forget sometimes how important it is with someone that is going through chronic pain to smile and to laugh. And again, I keep going back to the black dot. Their life is that black dot. Your job to be successful, to have client retention, like I always go back to that business aspect, right? If you feel good, don't you want to feel good more? Why do you think people are addicted to alcohol and drugs, right? Okay. You want to be their drug of choice. You're good. You're much more healthier than anything else. So you make them smile, you make them laugh. That helps. All those chemicals release the dopamine, the serotonin, the all of the things. We can get into that, but all of those things are released. They make them feel a little bit better. And actually, that helps them deal with their pain. Again, I'm not coming to you as a doctor, as someone who's prescribing medicine. I'm prescribing what I know works in 25 years. And that is being present, and that is being engaged, and that is being smiling and enthusiastic and empowering and being someone that can be here and hold you accountable, even if you mess up, right? It's okay. No one's perfect, but we're here. And that's kind of the message that I wanted to share for today because it's pretty universal. And when we talk about this whole idea of overcoming chronic pain, and getting through it and moving past it, there's not a magic wand. And I don't care what vocation you are in, whether it's business or fitness or nutrition, or you're a teacher or you're a CEO of a big, company in marketing or investments, you're going to deal with people. And it's that stepping back and seeing a bigger picture and reminding people that, okay, you see this being very myopic. Now let's see this. And I think it's important just to remember that. Remember what that positivity does for someone with pain. And I'm happy to send you some articles and some research as well about what that does for pain, the smiling, the laughing, the contact, the physical touch, what that does for pain receptors throughout your body. So again, whether it's, a fitness or nutrition client or whatnot, when was the last time you just put your hand on someone's shoulder and said, how are you? They could say fine, or they could, like I saw before with the chat, or they could have a nervous breakdown and start crying, but they need that. That's their release. I'm sure most of us have had that experience where you say hi to someone and they just start crying. And you're like, oh my gosh. And it's not you. They need that. They need that. And that's part of this overcoming. And again, that is a major step that all of us have the ability in life, not just to help lives and help people overcome pain, but actually help save lives. Because the more we can do in these little steps, the more it will benefit that person. And you know that if we can reduce some of their stress, through just being there, being present, being positive, what does stress do? Stress causes inflammation in the body. Okay, what inflammation through the joints, through the major organs. And there you go. Explaining some of this to them too is really important. So anyway, Debbie, I'm going to throw it back to you. I hope that gave you just some reflection. That's what I always say. I'm not here to tell you what to do. I'm just here to remind you and give you some different things to think about when you consider your own business and your own clients.
That was awesome, Christine. That was very powerful. Very powerful. Start again, if you don't mind. A couple joined a few minutes after the hour. Would you just quickly, before we take questions, highlight 1 and 8 with 1 and 2 with chronic pain? You had about 4 statistics there. Can you say those again for us?
Sure.
Okay.
So there are 1 in 8 people in the United States have 1 or more forms of diabetes. So either type 1 or type 2. But 1 out of 4 people do not know that they have diabetes. And again, they're, either they haven't been tested or, again, pre-diabetic, people have no idea until it's too late. The other thing is that 1 in 4 adults in the United States, and that's age 18 and over, have 1 or more forms of arthritis. And that could be osteoarthritis from, a former injury, or you're just, overuse. I don't want to say getting older. Let's say overuse. Or it could be an autoimmune form, like a rheumatoid arthritis or a lupus or psoriatic arthritis, something along those lines. But 1 in 2 people in the United States are in chronic pain. That is the statistic that really makes you sit back, because I just think people don't realize that chronic pain is mental as well. And when you look at suicide rates, people that are in chronic pain, whether it's physical or mental, those suicide rates keep going up and up and up. And I mean, right now, loneliness is now an epidemic. That's pain. That's chronic, disease.
It is. Yeah, you're exactly right. So 1 in 8 with diabetes, 1 in 4 who do not know they have it, 1 in 2 with chronic pain. That's not a stat that I knew. That's overwhelming.
Yep.
And 1 in 4 with some form of arthritis. So some of the takeaways, Christine, for me, hearing this is, I think when you see the data and look at, you said, just on this call or in our family and friends, our circle, chances are everyone is dealing with something, right? And I think the success and potential future success of our industry is honestly to embrace this kind of work. Get out of the mindset of fitness, get into wellness and population health, inclusive of chronic diseases and all that comes with them. Because we're using the term meet people where they are, and I'm over it. That term for me is so impersonal and not genuine. I can't stand it. And you're highlighting opportunity, Christine, for us to work with individuals and start with the human being in mind. have a holistic framework where we understand this is as important as sets and reps and the physicality of it all. And the industry needs to get on the page with this. This group's doing a great job. However, I think you're bringing to light a lot of things that we have opportunities in, and it's special. Like it's really, really important. I see Laura mentioned a client cried and just offering help. Just brilliant. I did a webinar with Hinge Health a few months ago, Christine, and it was on their platform, and the rise of MSK issues in America was brilliant, because that's huge too now with professional sitters. But the one thing I learned in that I did not ever connect in my career was how close depression and pain mirror one another.
Mhm.
We know they go together, but the physicality and the symptoms and managing was something that I had never really thought about. Very powerful, right? Before we open questions, one resource, gals, that is very helpful in working with disease states and different conditions, Victor Brick and
Mhm.
his Mental Health Foundation have on his website a tool, an interactive tool to put a disease state in, or a condition, arthritis, depression, whatever it might be. And then it has a formulary of what exercises you might prescribe for someone with depression and the number of minutes. So it might bring up Pilates, walking, meditation. Just talk about the fuzzy cat. Don't worry about the exercise. That was powerful, by the way. Talk about Tabby. That was good, Christine. Love it. So that's a resource, girls, if you're working with, I'm not going to say special pops, it's not a good term either, but individuals with challenges. That's the only tool I've ever seen in my career that's legit developed that kind of has an exercise prescription to it. All right, questions for Christine. Christine, that was powerful. I just read Matthew Perry's book, talk about pain, depression, and this. Someone with all the money in the world and just finally found a purpose in life, was at peace, and that's when he passed. If you can read the book, read it, because, yeah. Anyways, questions. There's got to be some. Liz, is that a question? She's writing? No, okay. I thought you were moving. You were going to your hit the button.
Hi, Christine. How are you?
Hi.
Thank you so much for this. But I just just to piggyback on the client, I think it was Laura who mentioned the client who cried. I have clients who do cry, and you're right. It's just like I let them cry, and I can see them holding back, and I go, don't. I go, just let it out. And then they're like apologizing because they're like, but I'm using up all this time. I go, no, you need to do this. And you said that, and that's true. It's like, depending on just how they've dealt with things, it's just, it's like, no, you've been holding this in probably for a while now. You just got to let it out. Just let it out. I'm not going to tell you when you're done, then we'll do something. But I do like all the things you were saying, and even Debbie, about it's not just sets and reps. And I just was listening to your Two Fit Crazies podcast with Patrick Mummy, and everybody should listen to that episode because he just brings up a lot of strong points with just the healthcare system, just how it's all broken. The system is so broken, and this is the stuff that we should be paying attention to and watching and hearing our clients about this stuff. Just giving them space, right? You don't have to be a therapist, I'm not a therapist, but just giving them that space to just do their thing that they need to do. And then afterwards, they're just so much better. They're like, okay, you can even see it in their face, and then their posture too. You can just see it, that good cry you just have to have. I don't know.
It's crazy that I've gotten, and I haven't really thought about this or really reflected, but I have not used sets and reps in years. Like, now that I think about it, because it's not I mean, all the you know, again, many of us, we've been certified in a bazillion different, you know,
Yeah.
fitness and wellness, like you name it, you know, like we've all had all the certifications. And I think that there's a lot of power in that. I really do. I think everything's a learning, you know, a learning experience. I think things are used in different things. I'm going to give a shout out to Anne. And you know, I'm going to do some seat with a new company. I'm going to pilot that. I just had to think about that as we were talking about this. I know, right? But there is something for everybody. But for people with chronic pain, you know, depending if it's physical, sometimes mentally it helps to think in numbers. I have to say that because it gets your mind off things. But honestly, use your breath. Use your breath because that actually helps more with getting that oxygen in, you know, through your body. And what's a muscle? Your brain, right? So we think of this whole mind body connection, you know, set a timer. I love timers. A minute of this. Do as many as you can. Oh, you got 3 this minute. Oh, great. You got 50 of this minute. But it gives them, it kind of takes mind, like the, you know, so you can have a conversation about cat fluffy as you're doing something.
Yeah. Totally.
And which is even better because now you're stimulating your brain even more.
Love that.
Which I think there's something to be said for that.
Joya?
Okay. And I just wanted to just put a little bit of context too in that encouragement thing and the seeing what you can do as opposed to what you can't do. I have to, again, shout out to Anne. I started my seat program yesterday at the club. I had 5 people because I still don't think they know exactly what it is about, but I had one individual who told me she was 78 years old, and we got halfway through the second song and she said, I don't think I can do this. And I said, well, hang on. I said, you're doing wonderfully. What can you do? Just whatever you can do, you do. And if you need to take a break, you stop. Well, let me tell you, she not only got through the entire class, but I talked to her afterwards and we chatted about, you know, what she could do and what her situation was and what bothered her, what didn't bother her. And she's already signed up for next week. So it's true. If I went with, oh no, well, that's okay. You don't have to finish if you don't need to. I just said, just sit back down. Whatever you can do, you do. And she said, oh, okay. And like I said, she got through all of the tracks, including the cool down and the flexibility portion. So you're absolutely right. Focus on what you can do, not the problem that you've got or the issue that you have. So I just wanted to share that because I want to and I have videos. A little bit. My husband came to take some videos, so I'll post that. So
Congratulations, Joya. That's awesome. Way to go, Anne.
Put
Way
them
to
on
go,
the page.
girls.
Put them on the page. Put them on our private page.
Way
Can I
to go.
Christine, thanks for coming today. Good to see you. Happy holidays.
Hi.
I find so many people at the club. Today we're having an electrical problem. Do you see all those lights are on and off? It's like the whole building is dark. How many people at this time of year really need that extra little mental fitness? And we're selling little like mini sessions at the club right now. Like if they walk in that day and don't have an appointment with Christine or Anne or Liz or whomever, they'll just buy 10 minutes, you know. We have extra trainers on the floor for consultations just to have that fuzzy conversation about the fuzzy cat or whatever. But most fitness facilities, the staff disappears.
Right.
And this time of year, I'm so proud of my staff because they're hanging out longer after their class. They're spending more time in those little mini conversations. They're doing a 15-minute session on what everybody in the women's facility wants, butts, glutes, right? But they're doing like little special things to keep people in the club because this is where a lonely woman feels comfortable. So just think about spending more time. Now the only thing I could think of is Fuzzy the cat, but this time of year, I'm proud of my staff and encourage your coworkers to do the same. I'm going to stay after for 10 minutes today.
Mhm.
Who wants to chat? I'm going to stay after. Let's talk about our feet. Let's talk about our feet, ankles, toes, our fat, instead of talking about our fat, So this time of year, everyone, I know I don't like to be alone this time of year. So just think about those people that are lonesome, and maybe
Yeah.
that extra 5 minutes that you have, that it's about listening. But thank you so much for your message. I was very empowered. Thank you.
Anne is our guest speaker next week, ladies.
That's right.
Yes, dear, you're on.
Oh,
Please, did you have a question? And then we'll wrap it up. We cannot hear you. I think you're speaking, and it looks like your mute's off, but yeah. I can read lips now. This is hilarious. You want to type it in the chat? Christine, while Lise is typing, if you would be so kind, if we could take you up on your very sweet offer of a few research articles. I personally would love to see those, especially this time of year. We're bringing a lot of things to light here: loneliness, depression, anxiety. So if you have anything that's kind of in that vein, that would be great. And if you send the recording, then I'll send out to the group as well. All right. Looks like Lisa's. Any last question for Christine? Yes. All right, Lise, how do you deal with clients through text? I work at Hinge Health, have over 500 clients that deal with chronic pain, depression, etc. How do you get them to engage via text?
Ooh, I was thinking you were gonna say, how do I handle all the texts? um, so so I guess engaging through text is, people are texters or they're not sometimes. I think that is really important to understand and to ask people. You can't force someone to engage in text or engage in email or pick up the phone and call if that's not their thing. I'm a big emailer. I get to my text when I can, or social media. I mean, is there a way that you can set up? Some people are much better if it's like a Facebook group where they feel like they're a little bit less removed. Sometimes a text is too much. That's like standing up. Sometimes that feels like you're standing up in a meeting saying, "Hi, my name's Christine and I'm an alcoholic." Like that's how they feel in a text sometimes. And they're not ready. The Open-ended questions sometimes sometimes they're just not texters. I'm going to be very honest. And again, I don't know if, have you ever done, like I said, Facebook has some really good groups where you can be a little bit more anonymous. Sometimes I use WhatsApp sometimes with certain groups, so I know that only certain people are in there. That's a little bit different. And then even, instead of, it's hard, but I'm like, instead of text, sometimes I'll do a Zoom, but no one has to put up their name or their face. So it's a little bit more anonymous. I do think if you just say to people, listen, I would love for you to engage and just give one answer over text. Be honest with people. Hey, this would really mean a lot to me if you would, give one answer. You'd be surprised when you actually ask and say, I need you. This is all semantics now. When I was a teacher, I would tell the kids, I wouldn't say take out your pens. I would say, I need you to take out your pens. So up here in their subconscious, oh, Mrs. Conti needs me. And I know it sounds silly, but these things they work. They work.
Lee, something we used to do in our corporate wellness programs with the hospital because of this, it was the transition moving off email into text space that time, to ask clients in the engagement form, the pre-assessment form, or the waiver, or in the pre-launch, how would you like us to communicate with you? What is your preferred method of communication? Text, phone call, what time of day, email, check both if to apply. That was a strategy that worked very well, because Christine's hitting on something. Text is not end all be all as a solution for communication in anyone's world. Some do, some don't. It just depends, right? So if you have a pre-assessment or an intake form, you might have the opportunity to get that from them there to customize the deliverable in the communication methodology. If you have time for that, and you may not with 500 clients, but if you look at the intake form that you're using, maybe you could tweak it a little bit if corporate says that's okay. Christine, this was amazing. A big virtual hug. You are amazing, just amazing. And the message is so timely. Ladies, thank you for coming. We have Anne next week, and we're looking forward to that. Christine, we always make space for 1 or 2 of our own talent to be speakers each quarter. So Miss Anne is coming next week. And if we don't see Christine before the holiday, happy holidays. And we'll be in touch. Thank you so much.
Thank you so much. Everyone, feel free to reach out to me if there's any questions, and I'll at some point get Deb, I'll get you some
no rush.
articles or some stuff to pass out. So
okay.
Thank you, everybody.
Bye,
Thank you.
Bye.
Bye.
Thank you.